Welcome everyone. I think we'll wait maybe just another moment or so. Hopefully we'll get a couple more people to join us. I do want to draw your attention. We'll be posting a quick disclosure in the chat function. So please do just take note of that as that's popping up here in just a moment. I do see that we have a couple more viewers joining us. Thank you so much. Alright, so once again, I'm going to just draw your attention that we do have a disclosure post. I do see that we have some more viewers joining on with us, so I think I'd like to just go ahead and get started. I'd like to welcome everyone. I'm Dr. Nikki Salerno. I'm a family physician here at Grace Health in Battle Creek, Michigan. I really appreciate you guys joining us today for this live question and answer about the COVID vaccines. These times have been exceptionally challenging for everyone, and we've had to make decisions and face things that we never thought we'd ever have to face before. I certainly never thought that I'd be practicing medicine in this kind of environment, nor did I think I'd have to make these kind of decisions or be faced with these things for my family and I. It can also be really difficult, to wade through all of the information that is out there. So we really do appreciate you turning to Grace Health as a trusted source of information for all of this. Over the next 50 minutes or so, I want to be able to address as many concerns as possible about the COVID vaccines. I encourage you to type your general questions in the chat, and I will answer them to the best of my ability. I would ask that you refrain from including any kind of personal information or any specific health questions. We certainly can assist you setting up an appointment with your primary care provider to be able to address some of those more specifically. But at this time, let's open it up to questions and have you guys get started. And if people don't have questions right off the bat, I can understand that. There certainly can be a little bit of hesitancy to try and ask questions. I can also always go over some general information, but I do want to make sure that we definitely target what your guys' concerns are today. Great. Well, let's maybe go over some general information, if that sounds good to everyone, since I'm not seeing a ton of interaction yet with the chat. Oh, good. I do see some questions popping up. Why do you recommend COVID vaccines? Excellent. So this is a great question. Vaccines are designed for a lot of different reasons in general. The one specifically for COVID is designed so that you don't catch the infection, or if you do catch the infection, then you don't necessarily have as severe of symptoms. No vaccine is 100% effective, and COVID vaccine is not any different. It is a little hard to hear me. Thank you so much for the feedback. I can try and speak a little bit louder. I don't know if there's a mic that I have necessarily. I'll just project and use my mom voice. So COVID vaccines are designed to help decrease the spread and prevent infection as well as severity of infection. So no vaccine is 100% effective, and the COVID vaccines are not any different. However, what we do know is that it does prevent this very severe cases of it. So as a lot of you I'm sure are aware, there's such a variety on how people are affected by COVID. Sometimes we have people that are completely asymptomatic and don't necessarily have any symptoms. But then you have the other people that unfortunately have very severe effects from the infection. We're also seeing, post-COVID syndrome, where we're having people or whoever having lasting effects that are 12 weeks out from active infection and are still having symptoms. So what the vaccines do is they help decrease the likelihood of being in the hospital or even dying from COVID, and helping prevent some of those long-term side effects. So it is something that is recommended for everybody. I would encourage you to specifically consider people who have underlying health conditions to seriously consider getting vaccinated. It tends to be the people who have a weakened immune system or have underlying diseases like diabetes, hypertension, COPD, and asthma that are most at risk of those people that are having the severe side effects. And so specifically for those people, it's important to be able to get the vaccine to be able to try and decrease the likelihood of those severe side effects. Got another question in here. Do we need an appointment to get a booster? So yes, this brings up a great question because there's a lot of new information out there within the last week or so for booster vaccines. So just recently, the CDC and FDA have approved boosters for all 3 vaccines, okay, for both the Johnson & Johnson, Pfizer, and Moderna vaccines. So first, let's talk quickly about the Moderna and Pfizer vaccine. These are the 2 mRNA vaccines that are in a 2-shot series. These are both eligible for boosters after 6 months from the second dose in people who are over the age of 65, as well as those that have underlying health conditions. We do need to have an appointment in order to set up getting a booster vaccine. Now for Johnson & Johnson, that also is one that has been approved for booster shots, and that can be received 2 months after your first vaccination. At this time, we currently don't have the Johnson & Johnson booster at Grace Health, but we do have Pfizer and Moderna boosters available. And great, what vaccines does Grace Health have? So those are the ones that we have. So for somebody who's starting with the beginning of the shot series, we have Pfizer to offer them for the initial 2-shot series. We do have a limited supply of Moderna that we are giving for those who wish to have the booster shot of Moderna. Now, it was recently just approved that you do not necessarily have to have the same booster that you initially received. In fact, there's some initial studies that show that if you got the Johnson & Johnson one and then get a booster at least 2 months later with either the Pfizer or Moderna, your immune response is actually improved. Your antibody response is better. So that's some interesting research that has just kind of come out. So like I said, currently we do have Pfizer for those that are starting the series, and then we do have Pfizer and Moderna for boosters that are available. And to be able to set up those appointments, you just need to give us a call, and we can get you set up with an appointment, either with your primary care if you have further questions, or if you just want the immunization, we can set you up on an immunization schedule where it's a quite quick in and out to get the immunization. And then at that time, we get you scheduled for your second shot. Let's see, how do I decide between which kind of vaccine to get? Is the mRNA vaccine better than J&J? So this is another excellent question. all of the vaccines have proven to be fairly effective. Now, yes, there are some minor differences. The Pfizer vaccine is estimated to be about 95% effective. Moderna is at 94.1% effective, so again, very similar. Those two are the mRNA vaccines. The Johnson & Johnson, which uses the kind of typical vector vaccine format that we're used to seeing, they're estimating it a little bit less effective than that, and there's kind of variable numbers on that. Now, the nice thing about J&J is it is a one shot compared to the 2 shots with Moderna and Pfizer. However, so the shot number of shots is different, and then the effectiveness is a little bit better with the mRNA vaccines. But again, it is a little bit of about an availability option as well as a personal preference option. I think overall my recommendation would be to get a vaccine that is available to you to be able to provide protection. And then there are some people that perhaps would choose one over the other for a variety of reasons. All right, so if the goal of the vaccine is to make antibodies, how do the antibodies prevent infection when antibodies can't help until the virus is in you? Oh, that is an excellent question. So yes, the goal of the vaccine is to make your body aware of what this virus looks like. So part of the reason why this virus has been so scary and so dangerous is that we don't necessarily have ever had exposure to it, okay? So there's a lot of viruses, a lot of things out there that we've been exposed to since we were children. Because this coronavirus is the new COVID-19, we haven't necessarily been introduced to it. So when it gets introduced to our bodies don't necessarily know how to fight it off. They don't have the specific antibodies, the specific cells designed to attack those virus particles and fight it off completely. Unlike perhaps the common cold that we've been exposed to multiple times before, our body has the specific cells, can get to it, fight it off, and we're done. So the idea with the vaccination is that if we can introduce something that produces a similar enough protein as the virus and can kind of mimic what that looks like, it can help our bodies build up a storage of antibodies or a storage of those fighting cells, so that when we do get introduced to the virus, then our stores are already go. The troops are already mobilized, if you will. And so then, as soon as we're exposed to it, we're able to fight it off. Therefore, our viral loads, the amount of viruses in our body, are quickly demolished, and we don't walk around with a bunch of viruses that we could spread to other people. And then also, our viral load never gets to that high number where we get exceptionally sick. So that's kind of the idea on the purpose of the vaccines. We do have a couple more questions. I'm going to go back up towards there. Okay, talk about side effects. Yes, excellent questions. So kind of like I was talking about, because the purpose of the vaccines is to build up those antibodies, to mount an immune response so that our body's actually ready when it does face the real virus, we can have some side effects from these vaccines. We can feel a little bit ill. And the symptoms that we have from them tend to be the same ones that we would if we were exposed to the common cold. Most commonly, the side effects that we're seeing is some injection site pain, so some pain on the site of the injection, which is into your shoulder. Some people also report having a little bit of a headache, some aches, a low-grade fever. I know I myself did experience some of those symptoms. We just planned it where we got the vaccine on a Friday, and Saturday I just sat and cuddled with the kids and watched movies all day. After 24 hours, I felt back to normal and felt back to myself. We have been seeing more people having symptoms after the second shot, if you receive the mRNA two shots, opposed to the first shot. But everyone's very variable, you know. And then there's also a lot of people, though, and I'd say kind of anecdotally, most in the older populations, that they get the vaccine and don't have any side effects at all. My grandma even told me, "Oh my goodness, Nikki, I can't believe you had side effects. I didn't even feel it." Okay, Grandma. You know, so she didn't seem to have any side effects at all. Well, yeah, I was kind of not my best for 24 hours. What would you say to people who are concerned about the vaccine affecting their fertility, and is it safe during pregnancy? This is an excellent question as well. There was absolutely a lot of information out there that was going around, a lot of misinformation, I would say, about questioning whether this is safe and if it affects fertility or is safe during pregnancy. Now, we do have a lot of research out there now about how safe this is actually during pregnancy. It is something that we recommend for people who are pregnant. And the reason for that is because when you're pregnant, the most severe thing and why COVID-19 is so dangerous during pregnancy is the high fevers. We really want to avoid our pregnant ladies having high temperatures, high fevers, and having that severe disease. We also know that COVID-19 can cause blood clots. When you're pregnant, you already have a higher risk of blood clots than when you're not pregnant. So this combination of pregnancy and COVID-19 can be very dangerous. So we want to make sure we avoid having a severe illness with COVID-19 while being pregnant. The vaccine has been proven to be safe. There actually was a great research article that was posted in JAMA specifically looking at miscarriages and whether or not there is a link between getting the vaccine and miscarriaging. And they found that there is not any link between vaccines and miscarriaging. And so it is safe during pregnancy. Now, granted, if you are a pregnant lady who is debating about this, I think speaking with your OBGYN is an excellent option to be able to really address those. If you've been vaccinated for COVID, what other precautions should you follow to avoid getting the virus? Yeah, so this is a great question because, as we said, there's no vaccine that's 100%. And so likely there will be a time when you come in contact with someone else who has COVID. And so trying to follow all of the recommendations from the CDC as far as wearing a mask inside, social distancing at least 6 feet apart, is really, really important. Now, it is nice that if you are vaccinated, there is some freedoms as far as outside, being unmasked and being with other people who likewise have been unvaccinated, to be able to enjoy some of those things. But yes, we still do recommend taking those precautions, and I think really making sure that you, as well as the people that you're around, are comfortable with what is going on. I think that's a discussion that really needs to take place amongst families and friends and those who are gathering, to make sure everybody is comfortable and on the same page, especially with the holidays coming. It seems like the vaccine was created so quickly. How do we know that sufficient testing was done to deem it safe? Yeah, thank you so much for this question. This is an excellent one. And actually one that I had a lot of hesitancies about at first as well. I was excited when initially there was a vaccine that was, available. I too, though, was, gosh, this is a newer kind, mRNA vaccines. Is this something that is safe? So I myself did a little bit of research before I got it and before I decided to have my family get it. And it turns out that mRNA vaccines have actually been in study for a long time. So mRNA was first really discovered in the 1960s, and then from there, research had really taken off. It initially started as using mRNA as a way to administer medication for cancer patients, and then specifically vaccine development really started in the 2000s. Moderna specifically actually had 9 mRNA vaccines in the works before COVID-19 hit. So they were already working, and in fact, in third stage clinical trials on mRNA vaccines against influenza. Rabies, the Zika virus is another one that they were working on. So the research actually has been occurring for multiple years. And one of the limiting factors, or a couple of the limiting factors on vaccine research, can be both finances, as well as the number of people willing to volunteer to get it, right? A lot of times when these vaccines or drugs in general are going through clinical trials, there's not always a ton of people that are very anxious to sign up for studies necessarily. And so why this one, the COVID vaccine in particular, was able to go through those trials, those setting up trials, what seems more quickly, is because all of a sudden there was a ton of funding, right? We had a ton of funding. We also had a lot of people that were willing to sign up for it. So when you actually look at the process of the vetting that we had to do for vaccines pre-COVID and then with the COVID vaccine, the COVID vaccine actually had more volunteers and was studied for about the same amount of time as the other vaccines that are out there. It was just that it definitely appeared a lot quicker and the process seemed to go quicker because it was all hands on deck. You were able to really have all the finances and all the right people working on it to be able to develop it so quickly. Excuse me just a moment. All right. Excuse me. All right, so I'm going to scroll up and make sure that I didn't miss any questions real fast. If it becomes FDA approved, do you recommend vaccinating younger children? Yeah, this is a great question and actually a very interesting one because this morning, right before this, I was reading and looking up the research because there has been some recent developments in this. And I think as a parent who's been vaccinated, I think I had a similar one, so I'm going to just make sure I read this. Why do I have concerns when it comes to getting my kids vaccinated when it is approved? Will they be the same vaccines? Okay, so kind of a similar question, so I'm going to address both of those. So just recently, the FDA had an advisory committee that met last night to review Pfizer's data that they provided on a vaccine or the vaccine at a lower dose for those ages 5 to 11. So this would be a 1/3 dose of the vaccine given in a 2-set series with the same 3 weeks in between. Now, the FDA Advisory Committee did last night recommend, with a unanimous vote actually, to approving emergency use of this vaccine for children. It still needs to go through the formal FDA as well as the CDC, and I believe that they will be meeting within the next week or so. So there were some predictions that within middle of November, if everything is full approved, then we could start offering vaccines for those ages 5 to 11. Like I said, this is a 1/3 dose of it. Now, the Johnson & Johnson and Moderna have not yet had any approval or had gotten any closer. So the Pfizer would be the first one. Now, to get to the question of, as a parent who's vaccinated, why do we have concerns about kids? This is a great question. And I think it's mostly the school-age children who are then going and mixing with a lot of other children that are coming from other households. Kids, the schools have been doing an excellent job trying to follow, regulations and recommendations as far as masking and social distancing, but it's difficult, especially when you have the 5 and 6-year-old kids. And so having them who are intermixed with a bunch of other kids from a bunch of other households that may or may not be vaccinated, there is the potential for them to bring the virus home, as well as get sick themselves. Now, yes, it's true that we are not seeing as many children getting as severely sick as some of our older populations. Unfortunately, we have been seeing, though, that kids can get really sick and do have people that are in the ICU and kids that don't have very good outcomes from COVID vaccine. It's not as common, but I think, it's just as tragic. We also know that COVID produces a multi-system inflammation reaction in some of these kids, where we're seeing some really, really, really bad, massive inflammation in the children, and some severe cases of that. So we do know that it's not as common, but it can be as severe. And so getting these kids protected can be really important, not only to help protect them, but to help protect everyone that they come in contact with, which if they're going to school is probably quite a few of them. making sure I answered those questions completely. Another question here, can you talk about COVID precautions taken in the office? Okay, so, and I think that question, and correct me if I'm wrong, about what kind of COVID precautions we're taking in the office here at Grace Health, perhaps. So, you know, if you come see us, I understand there's a lot of patients out there that are legitimately hesitant about why come to a doctor's office where there's all these sick people, right? So what kind of precautions are we taking, both for our staff as well as our patients? So first off, all of the staff do have to go through a screening process every morning, and if they fail screening, they have to get a rapid COVID test before they can be allowed into the building. For those patients, all of them are screened on the phone when they're calling to set up an appointment to make sure that they don't have any symptoms that we would be concerned about. And then there's also signage out front that we ask that if you are experiencing any of those symptoms, to give us a call first, and then we can properly decide, okay, do we need to you know, reschedule your appointment to continue to see you for the appointment for the day, or have you see in our 6th suite. So Grace Health did just open up a 6th suite where it is a designated area out of our east building for people who are having COVID-like symptoms, or even who have COVID that need to be seen on site. We understand that there are people out there that a virtual visit is just not going to be appropriate for. We try to do things virtually and be able to address all of the needs then, but sometimes we can't. And so when we need to see you on site, when we need to have a provider actually look and listen to you, we have an entire area that is set up designated for people who are feeling ill. We have the capability to do rapid COVID tests up there, and all of our staff at that time also have proper PPE to be able to help protect them. Now, if as a patient you come on into Grace Health, we are asking that you wear a mask in any sites, both well and the 6th suite, as that really does help cut down on infection and helps protect you guys as well as our staff. Right now, we have booster shots available to select eligible groups. Yes. Do you anticipate this opening up to anyone 18 and older? And have there been reported side effects from the 3rd shot? Okay. So yes, I do anticipate that eventually it will open up, most likely. I think they're looking at a lot of different factors on why they are selectively opening to some groups versus the other. You know, the research is showing that immunity to these vaccines are waning around the 5 to 6 month mark, which is why they're then recommending to get the booster shot. Right now, they're prioritizing those that are most at risk of having severe COVID infections. So that's where you get the over 65 and those that are at higher risk with underlying health conditions, as well as those that are most at risk because of exposure. That's where we get those guidelines and those recommendations from. I don't know exactly time frame, you know, when that might open up, but I have a feeling it probably will open up to the general population once we're able to assure that we can get those high-risk populations vaccinated and be able to have them have good sustained immunity before opening it up to everyone else. Now, to follow up about the reported side effects from the 3rd shot, we're seeing similar side effects as we did after the 2nd. So again, that headache, low-grade fevers, achy bodies, pain at the injection site. Those are the ones that are most common right now. All right. Okay, the trials. FDA has not approved the vaccine, only authorization used for emergencies. FDA approved the biological, hang on, sorry, it's jumping on me here. Licensing for a product called Comirnaty. This product is not available in the U.S. without animal testing. How can this be deemed safe? Okay. So I am not familiar with the product that you are referencing. It is true that right now it is just the authorization for emergency use for most of them. Excuse me. You know, and so I can understand certainly where people would be concerned. Again, it kind of goes back to that question of, well, gosh, did this happen so quickly? And I think it was really that things were able to move as quickly as they were just because everybody was working together and working on this. And yes, we have quite a bit of good research, but I can also understand, well, look, we don't necessarily have those long studies that, of course, all of us would want. And I think it really does, unfortunately, come down to that weighing the risk and benefit. Now, when you talk about animal testing, I know I did read some reports of mRNA vaccines being tested in animals through the development of some of those other ones that I had talked about with the other viruses. There was actually quite extensive ones done in mice over multiple generations through pregnant mice, as well as like I said, multiple generations, looking at a couple of them down. Now, granted, I understand that that is not the same as human studies, and I think time will show us, and we will continue to research and continue to be able to look further into it at that time once the data is available. So, and I do appreciate that a lot of these companies have been making a lot of the original data available for research, which I certainly appreciate as a clinician, to be able to actually go back and read the original articles and the original peer-reviewed research, which has been helpful for me. Okay, I'm just scrolling up to make sure I didn't miss any. Any questions? In your best guess, do you foresee a COVID booster becoming similar to that of a seasonal flu shot? That's a great question, and I really wish I had a good answer for it, because I don't know. We are hopeful that by having the booster, that will be able to give us enough sustained immunity. And then there's also a lot of theories and questions as far as, well, once we reach, herd immunity, are we going to need to continue to have boosters? And I think, unfortunately, it's just too soon to tell as far as if this is going to be something that we need. One of the challenges, of course, that we hit with COVID, as well as any viruses, is that they do mutate. And that's where we get all of these different variants, right? So the Delta variant. And so because of its rapidly changing, there is the possibility that we might periodically need boosters to be able to better target it. Now, right now, all of the vaccines that are out there actually provide pretty good coverage over the variants, including the Delta variant. Yes, it is showing that the vaccines are a little less effective against the Delta variant than the Alpha variant. However, it is still effective against it. And likewise, they are showing that with the smaller doses for our pediatrics, for our 5 to 11-year-olds, are also covered. So I wish I could give you a better answer than that, Marcus, but I'm not sure at this time. These have been great questions, and honestly, all of these questions have been questions that a lot of my patients have brought up to me. So I think, and would like to reassure all of you that a lot of you are having similar concerns and questions, and I think that they're all very, very valid. Thank you. So we definitely still have a good 20 minutes left. I do keep seeing our viewers popping up here, so if you are just joining us, thank you very much and welcome. We do want to encourage you to type any general questions into the chat. This video should be made available afterwards as well, so if you missed the beginning and want the answers, absolutely, we'll be able to get that for you. And then I do want to bring your attention to our disclosure. We want to answer as many questions as broadly as possible. However, if there is any specific health questions, we really do recommend setting up an appointment with your primary care provider to be able to specifically address those. Scrolling through, making sure that I have indeed hit everybody's questions. Okay, the majority of my coworkers are vaccinated, but we do get visitors. Are there any precautions we should take? Yeah, absolutely. That's a great question. I'm glad to hear that, coworkers are mostly vaccinated, because that does help those that come and visit that perhaps are not vaccinated. That does kind of help cut down on the general viral load that we might be having around. And so that's a good start. As far as other further precautions that you should take, I still do recommend masking as much as possible and when able to, as well as making sure to keep social distancing. That close proximity is something that we really want to try and avoid, especially if you're not wearing a mask at that time, just because we know that they're effective. So as much as they're hot and they're sweaty, and I feel like a teenager with all the acne that I've been breaking out with lately, it is really one of the best things. And just, and encouraging that if there are people that have any questions about vaccinations, having them be referred to their doctors to be able to have a conversation about it. We understand that there are people that are still not going to be feeling comfortable with it, and that's okay. That is their choice. But absolutely want to be available to be able to answer those questions. All right, for those who just joined, could you please repeat why you recommend the COVID vaccine? Yeah, absolutely. So, the vaccine has been proven to be highly effective against preventing severe disease with COVID-19. It is not 100%, no, but we are seeing that it does protect the majority of those severe cases of people that are ending up in the hospital and unfortunately, dying from this terrible disease. And so it is something that has been proven to be effective. And I think the more we can build up our immunity, both individually but as well as a community, then it really does help us get back to some of those events and those big things that we like to enjoy doing and kind of return to normal. I'm not sure that our life is ever going to be the normal that we once remember it. I know my children will be forever changed living through this kind of experience, but I'd like to think that when we do return more to normal, it's going to be with a more awareness for others and for the safety of others. So it is something that I do recommend to people. But again, I understand that there's a lot of questions and concerns, which is why I love having this opportunity to be able to answer some of those questions. And we definitely have hit, a lot of the big ones. So again, if you're just joining us, I highly recommend when this is available to kind of go back and listen to some of them. A lot of these are pretty common concerns that I hear quite frequently and even shared, myself at first. So absolutely. Again, I encourage you to go ahead and put some questions in the chat. I think I've hit all the ones that have been posted so far. definitely been, a lot of exciting, changes going on as far as recently with the approvals. And so, if, for example, you're not in that category of qualifying for a booster yet, stay tuned, because I imagine that we'll be having quite a bit of changes coming up. All right, is it safe to get a flu shot and a COVID vaccine at the same time? Yes, it is absolutely safe to get the flu shot and the COVID vaccine at the same time. And it's also safe to get the flu shot and a booster at the same time. So if you're coming in to see us, you might as well get poked, and we'll just poke you good and be able to get all of them. It doesn't increase your likelihood of having any side effects. In fact, people who perhaps do have, that slight headache and, body aches even after getting the flu shot, you might have that from the COVID shot. So, if you get them together, then again, you kind of chuck it up to knowing that you're going to have 24 hours of binging TV and relaxing, and then doing much better. So if you're going to do it, you might as well do it good. Get both of them. As a follow-up, the question might be, is it necessary? Is it necessary to get both the flu shot and the COVID vaccine? And that's also a very valid question. These viruses are different. It is possible to get influenza or the flu as well as COVID at the same time. You can, as well as separately. So getting both of them really is something that we do recommend to help be able to protect you from both of them, as we can see serious side effects from both of those. Absolutely. All right, what is the difference between the rapid and the standard COVID tests if I get one? Okay, that is a great question. So the rapid tests, most of them that are out there, you can get the results in about 15 to 20 minutes. The standard one usually is about 24 hours. The technology that we use is a little bit different on how we detect the virus. The original one probably is a little bit more effective or a little bit more accurate than the rapid one. So there might even be times when we do both, especially if a rapid, for example, is negative, but we have a high suspicion that this actually is COVID due to contacts and symptoms and things like that. Then sometimes we do still send off the PCR. PCR is just the kind of technology that we use, and that can sometimes come back positive. So, all right, I see a couple of other questions popping up. So, can or does the COVID-19 vaccine deter spread, or is only to reduce the effects? So that's a great question, and the verdict is still a little bit out with it. Originally, it was designed to reduce the likelihood of having severe effects of it. Now, it also makes sense, though, that if we're not having as severe of effects, we don't have as much viral load, so we don't have as many viruses or number of viruses in our body hanging around. And so then if you have a very low number, you're less likely to then spread it to someone else. So there is some conflicting models, on does this help protect the spread. And of course, that's also really difficult to track, because there are people out there who have completely asymptomatic, COVID, and we found that out from the very beginning, was that it's possible to test positive for it and theoretically spread it, but we don't actually, don't have any symptoms. So there's not a good way of determining whether or not that person was positive, unless they specifically had a test for, another reason. But they do suspect that yes, by being vaccinated, we can help deter the spread of it, just because then we don't have as much of it around us and in our body and spreading it to other people. So, it is true when we say, gosh, this is a decision not only for me, but also a decision for the people around me and for my family and the other people that I'm coming in contact with. Absolutely, because if I don't have as much of it going on in my body, I'm less likely to spread it to the people that I'm in contact with. But that is also why it's still really important, and why we're also recommending to still continue to wear masks and do all of that, even if you did receive the vaccine and you know that you're in close contact with people. If you have had COVID but are getting the vaccine, do you have to wait a certain amount of time in between? Yeah, so that's a great question. There is a little bit of variability in this as well, but usually we want to wait at least 2 weeks from the infection. Okay, so 2 weeks from basically when you get out of quarantine, as long as your symptoms have improved, right? We want to wait about 2 weeks and then get the vaccine. Now, that also kind of piggybacks onto another great question of, well, why do I need the vaccine if I already had COVID? Because I hear that a lot. And I think that's a very valid question. I think that goes back to the fact that viruses mutate. And so although, a person might have COVID from one of the variants, that doesn't necessarily protect you against those other variants. And so by getting the COVID vaccine, you are helping protect yourself against the other variants that are running out there, as well as potentially even future variants. So it is something that's still recommended. Then the follow-up question to that, which some of you might be thinking is, well, why does the vaccine protect against all of the variants and having it doesn't? And that's a great question. And that goes back to how the mRNA vaccines work. And that's because they're able to mount that immune response against a generic enough protein that's common in all of the COVID variants that we're seeing to be able to help give that protection and give that immunity, opposed to, again, if you were only infected very early on with the Alpha variant, right, and then if you got exposed to the Delta variant, you still could get COVID again. You still could get sick with it, and so the vaccine helps protect against all of that. Besides my PCP, what resources on the internet would you consider a good resource and not likely to be fake news or politically driven? Yeah, that's a great question, because there's so much information out there. It can be really difficult to wade through. Absolutely, the CDC actually does a really great job of providing information, both to the general public as well as to providers. And so there really is a lot of good information, and that would be a good trusted resource. Now, I know there's still people out there that are saying, well, gosh, is there a motive behind that? Okay. So some of the other resources that I often look for is the actual medical journals. Okay. So if something comes from like a .edu, comes from a university, a medical university, that's a good trusted resource. I think I mentioned earlier the Journal of American Medicine, JAMA, is one that I use a lot. New England Journal of Medicine is another one that will produce it. And a lot of times on their website, they have some pretty good, broad articles out there. And then if you want the nitty gritty, that's absolutely available to be able to kind of delve into it if you're a numbers person or things like that. So those tend to be the resources that I use. American Academy of Family Physicians is another one that I commonly use. And then if you do see an interesting report on some of those other news ones, so whether something pops up on Facebook or something like that is interesting and sparks your interest, take a look at it and then scroll to the bottom and see what are the references, and then kind of follow the links, follow the references, and kind of go back. And that's something that I often do, especially, at the beginning when there was a lot of information and I wasn't sure what to trust, who to trust. And so I always scroll to the bottom, follow the references and follow the links back and see, okay, is this actually something that is a trusted source? If a person already had COVID, should they get the vaccine? Awesome, Debbie. I think I hope that I addressed that a little bit earlier. What's your thoughts on masks decreasing the oxygen in lung tissue, and your thoughts on how or if this increases the chance for the virus? I read that the virus uses furin cleavage sites to merge into your lung tissue to infect you. Therefore, wearing a mask decreases our ability to fight the virus. Okay. So that's interesting. I certainly would be interested in the article that you read about that. One of the things that we do know, and actually I just read an article about this because they had I think it was the state of Michigan that just did a pretty good one about masking and the efficacy of it. And one thing just to kind of be clear with masking is that masking is beneficial mostly to help protect the spread. Okay, so if I'm wearing a mask, it is possible for a virus to get through the mask, especially if I'm wearing a cloth mask, which of course is better than nothing, but it is possible. The mask is primarily there for me to protect the people that I'm around. As I talk, or if I sneeze, or if I cough, I have a tickle in my throat, I could spread particles, right? Saliva, spit particles. And that's where the virus is. So having a mask helps collect those particles, even just when you breathe out, you exhale. You're exhaling some moisture particles that could potentially have the virus. So by having a mask, that is preventing me from spreading whatever I might have to other people, okay? Now, the masks itself don't necessarily decrease the oxygen in your lungs. And this is something that we have a lot of data and a lot of proven research on just by checking people's oxygen, right? By putting them in masks and checking their oxygen saturation and making sure that oxygen is still getting in there. Masking is not necessarily a new thing. It's something we've been doing for years, maybe not in the general public, but for example, our surgeons, our surgical techs and nurses that are in the ORs all day long, they've been living in masks for years now doing their job. And still able to perform, very high mental tasks and be able to get plenty of oxygen into their lungs to be able to perform their tasks and what they need to do. So we do know that it is safe to wear a mask, that you can still get oxygen in. And again, send me that link. I would love to try and read as far as if there's anything new out there. But from what I've read, wearing a mask doesn't necessarily decrease the ability to fight the virus. Absolutely. There are other things, because we know that COVID is primarily a respiratory virus. People who have underlying respiratory diseases will have a harder time in general fighting it off. So people who have COPD or are smokers, asthmatics, that don't necessarily have as strong or as healthy of lung tissue, might have a harder time and might suffer some of those more severe consequences. So those are people that we want to be particularly careful with. Quickly scrolling back, making sure I've addressed everyone's concerns. We do have about 5 minutes left. Wow, that time flew by. I didn't think that we had already gone through that much, which is excellent. I think that we've really covered quite a few topics. I really do hope that this was beneficial. So if you have any, last minute questions, go ahead and pop those in there, and just remember that we are available to answer all of your questions to the best of our ability. And if you have any further, specific questions about your health or health of a family member, please set up an appointment with your primary care. We'd love to be able to sit and talk further about all of that. All right, has there been breakthroughs that have led to any insight as to why some are asymptomatic and sometimes it can lead to a quick death without vaccines? Yeah. Not to my knowledge. It is something that we are fervently trying to research, because it is the great puzzle, and it is unclear why some people who are relatively healthy will have terrible side effects, or even death from this virus, and we don't necessarily know why. So I've not unfortunately heard of any breakthroughs that have led to any insight. In general, my recommendation is let's keep ourselves as healthy as we can. And so if you're looking for, okay, what can I do? What else can I do in my health to be able to help protect myself. They're kind of the age-old general recommendations that our moms give us, right? Make sure you get plenty of sleep, okay? Make sure that your body has plenty of time to rest and recover from it. Make sure to eat those fruits and veggies, right? Making sure that we have a good healthy diet, and if your doctor recommends any multivitamins, there's a lot out there. They might recommend that specifically. And then just making sure that we're getting exercise and being active, in a safe environment. So the more active we are, I don't want you to equivalent activity with weight loss. Activity is good for our heart, good for our lungs. It helps strengthen those. And so making sure that our organs are as healthy as possible can give us the best possible chance to fight this off, and to just stay as healthy as possible. So Mama was right. So those are definitely my general recommendations. But I think this definitely has made science kind of look at a lot of other things and explore a lot of things, and really get the general population more engaged about their health as well, because it is having such an effect on everyone. So yeah. All right. Well, I think with that we'll wrap this up. Again, thank you so much for joining us for this live question and answer. I think that we've had a lot of great questions. If you missed any of them, we will make sure that this is available for you to be able to listen to those. If you have any further questions, please reach out to your primary care. We'd love to talk further about you. And I want to let you know that we really do appreciate this opportunity to be able to talk with you, to be able to answer your questions, and that you guys really do trust us with your health, and we look forward to continuing to serve you. So thank you very much.